You picked up a tip or two from me. That's so nice because that just encourages me to do more. And I am so glad to be part of your journey. There are 3 devices here, and I'm going to go over them, and I'm going to give you a bonus on how we can add on a nebulizer and combine it together so that way it is one treatment and saves you time. The biggest concern I have is skipping treatments, skipping sessions to get rid of the phlegm, and it lingers and it lingers, and then you start sounding really bad that people start giving you antibiotics and steroids over and over again. So it's so important that when in the beginning of this, you're very, very aggressive and you are on the clock. If the doctor said 3 times a day, you're on the clock 3 times a day. And I know if you're working, it's very hard. I would have showed you the little portable nebulizers, and maybe you could just do that when you're on the go. If you really need a more intensive treatment, then I'm recommending you to get a nebulizer, of course. So you would do a nebulizer before your treatment with a flutter valve or a cough assist device or a cappella. I'm just reviewing this just in case you haven't heard and you just want to get a brief idea as to how we get rid of it. It is on you to cough the phlegm up, and if it doesn't go away, to reach out to your doctor so they can optimize your care. We have 3 devices that I'm going to go over and 1 bonus at the end. The truth of the matter is, if you don't get rid of the phlegm, it's going to cause you hell and cost you way more, and probably pneumonias, hospitalization, multiple visits to the doctor. And so all this is really made so that you understand the part you have. No one else can do this for you. It can be written on a script, but if it's not done, it's not done. This here is the Vopacare device. And you're going to ask, where can you get this? You can look at the links, or you can just search it up and buy it wherever you like. I'm still trying to promote the fact that you're going to get rid of the phlegm, okay? So this is the first device that I chose, and I just want you to get the cough up. So if you can really cough it up and it doesn't sound wet over here, you're good. But if it still lingers and you are hacking, and somebody has said you have bronchiectasis, you really need to pay attention and you need to stick around. And if you are here, that's a good thing because we need to talk. This is the device. Now it has inside of it, this is a Vopacare, getting rid of the phlegm. That's the whole point. If you do all this and nothing is coming out, maybe it's time to book that appointment with that doctor. Metal balls. And obviously you're gonna have to clean these. And please watch the videos that I show you guys about cleaning because it's very important. These balls come right out and you can change them according to your need, okay? All right, so I'm gonna put this size inside. But if you feel that size is not doing a job, try, a smaller size or a bigger size according to how you feel. The point is that after you're done, you're expectorating. That's a big word. Rather, we discuss the minimal things that we can do, and we can talk about the upgrades in a different video. But I'm saying to you that if you have early bronchiectasis or bronchiectasis that is out of control and you want to try something even before you see your doctor, obviously I'm not your doctor, I'm just educating on here. I am going to say that you could go on Amazon and definitely look for devices that help you cough. Just be very careful. Make sure that you get something that's reputable, that it's not something like a breathing device, but actually a device that helps you cough up the phlegm. So I'm reviewing this one. Like I said, this one is called Vopacare, and I've tried it. It's very simple steps here, and you could wash these. I've done videos on TikTok how to wash your devices. Make sure that you wash your hands and they're clean. You close this up. If you're changing sizes, like I said, there are 3 sizes here. That's one size that's inside. There's a mouthpiece that sits here. You take that out and you can put this in. Make sure it's locked. That's a good thing because you see it didn't lock and it just popped up. So you would nebulize and then you will it's a pretty big workout, right? Because you're going to give a very big effort, and the whole point of this, if you have phlegm, it will vibrate that phlegm and bring it up. But the best thing is, like I said, you would nebulize, and let's hook this nebulizer up. It is loud, but you can definitely use the portable ones if that's all you have, guys. It's all about your finances, your prescriptions. I am just trying to tell you that you can't have that linger because it's going to cause you really, really bad problems later. So this little device, yes, I do show it on my Amazon store. I have it. You can look at that, but you can also look at other nebulizer devices, or you could use yours. You don't have to buy a new nebulizer. Just You need to have one. If you have bronchiectasis, that's one of the things that I would say as your pulmonologist. If I was your pulmonologist, I'll make sure you have a nebulizer, because we got to get rid of that phlegm. I don't want your bronchiectasis to get worse. Obviously not. There are degrees to it. I want to be caught before it starts. And then if you do have it, I want to catch you early so that we can hopefully regress it. And let me tell you, when it's very severe, it is permanent damage. So we are not discussing that right now. Anyways, yeah, and then it's hell. And I discussed that. It's hell because it's got pneumonia over and over again, hospitalization, IV medications, you just permanently with the doctors and hospitals and urgent care. So I just want you to know, yes, it's pure asthma. Yes, asthma can do it. And many other diseases, we're not discussing them here. Like what? Cystic fibrosis and these others, right? But what I'm saying to you is that you really need to make sure that if you have a diagnosis, you follow up with the doctor and they're making sure that they've controlled you. So for asthma though, don't forget, you have inhalers that I discussed that you need to apply to make sure that your asthma is controlled, right? Yes, because you still may have asthma and you may not. And if you have bronchiectasis, I will make sure with your doctor to check you if you have asthma, because obviously this alone won't do it. This is just to get rid of that phlegm, because we don't want it to be in your lung becoming a septic tank, right? And the septic tank is just infections hell, basically, okay? And destruction of your lungs, that is irreversible. At some point, it just destroys the lungs completely, and you render them kaput and they can't work and they become a disaster. So here I am again, asking, pleading to you that you find out if you have bronchiectasis by getting an x-ray. You should get an x-ray, obviously. If you have asthma, if you're of age, obviously I'm an adult medicine doctor, I'm a pulmonologist, but if you're pediatrics, you have to go look somewhere else, maybe check with somebody, who specializes in that group of very fragile patients. But for the adults, I'm talking about you doing what you need to do here. I'm the correct person to follow, because I will definitely be putting out lives discussing this very, very important topic. That is, again, bronchiectasis. These are nebules. You'll need scripts for these. Some people even have saline put in here. This is the one I said you can nebulize with. And I've had videos that relate to that, but I'm going to keep you to the end, yes, and show you how to do that, because I'm right now trying to review these devices for us so that we have options. So you get it from your pharmacy. Some pharmacy may carry it. Some DME can carry it. If it's difficult, Amazon, okay? Depending on where you are, go to your medical supply. Pick it up, look at the name, see where you can get it shipped to you, okay? Now, some of you get it from the hospital. Take it with you. You already use it. They're not going to use it with anybody else. Keep these things. They're gifts, because the bill is very expensive too. You need to pick one if you have bronchiectasis, you do. And if you do not need to pick one, then you need to talk to your doctors about what to do about that phlegm. It cannot stay there. It will be a problem later on. And later on, it's a bigger problem for you and more costly and sometimes irreversible. So again, my name is Dr. Mkono. We're going down the line. Hopefully you're still sticking it out, because as we're doing this, I'm discussing these and I'm also giving you hints about your care. Things that you need to be attentive about. So you see, you want to spend some time taking deep breaths so that this mist right here is in your lungs. And you do the whole treatment until all of that is done, right? And this is the part where I say, if you're really running out of time, and obviously time is money. People are so busy. They're not able to do these treatments, but they also depend on them to get their breathing better, to get their bronchiectasis better. So it is a nightmare for the patients who are working full-time at home. Retired is a whole different story. They're also non-compliant, I'll tell you that much, but you cannot be willy-nilly about it. You have to be very, very aggressive about your care. Cleaning up your lungs is one of them. Otherwise, you're not going to breathe well and you're not going to do well, and your bronchiectasis and destruction will continue. And remember, it can be very much irreversible. And this is where I emphasize how important I've dedicated this series of bronchiectasis to you, because it is one of the endpoints to asthma. If you do not listen to what I'm saying, what everybody else is telling you, maybe they're not emphasizing it. That's why we're going to spend some time together. Go back to your doctor and ask them these important questions. But you have finished with nebulizing, of course. You nebulize to the point where all this liquid is all gone. Take nice deep breath. And remember what I said before. I'm not going to be able to do that with you. Otherwise, you will probably run away. And for some of you, you're good patients and you're still here. And I thank you. I will definitely make it worthwhile for you. I'm not keeping any secrets. I'm just telling you that these are the devices I'm reviewing. You definitely can pick your own. They're not inclusive of every device known out there, but you can ask your pulmonologist or your doctor which one they prefer. And if you don't have a point to start, this is a good point to start. And I'm trying them out for you so that you don't have to go and try them out. Now, I can only speak about the expenses in the sense of cheap or expensive. Go on Amazon and check out what the prices are to find out what's good for you. This one, I believe it works very good, okay, for its price. And it's the lower cost one, okay? And it's easy. You go, and I already showed you how to set it up. Very easy. Cleaning it up is the same. Dishwashing liquid is what I would recommend. And please don't leave anything that's corrosive on for you to breathe. Wash off, rinse it off really, really well. Air dry it. Don't put particles in it because we are blowing in and out in our lungs. And so we don't want to put food particles and particles that, you know, shouldn't go in your lungs and cause us more problems. So you want to make sure you have a dedicated area to clean up. Please look up my videos on Amazon. I have plenty on the live showing you guys how to clean it. I had a whole show about how to clean your devices. And therefore, please take them apart, clean them, make sure that they are nice and clean and sterile. Do not use any alcohol. If you want to, you can. I believe it's just, you know, it's your preference, but I prefer, you know, you could use peroxide if you want. I prefer to use dishwashing liquid and wash it out really good. Some people can even put it in their dishwasher. It's all up to you. I prefer to wash things in my hands. I think it's gross to put it in the dishwasher. It's up to you how you're going to do it, but please make sure you clean your devices. Very important. So we are done with the first one, which is VoperCare. And like I said, you have 3 parts to it. This twist all on, and if you don't close it, you see, it comes out. So make sure that you make sure it all settles in there. And then there are 3 parts, okay? 1, 2, well, there are actually 4 parts, okay? And then you twist it, right? Oh, don't break it. There, it's a tight, it doesn't move. And then, and you have, I can't remember if there's 2 of these mouthpieces, but you have this. And you can make them smaller. And if that's too tight or it's too loose or you don't feel like it's actually doing the job, you can make it harder, okay? So I will be putting a write-up on this on my website, so you could look up, if you prefer to read, right, and look up under education, how to use flutter valves. I'm a pulmonologist. Second device, aeraventus. Oh, okay. You know, I don't fall in love with the names. I just fall in love with what makes you breathe better. Can get the phlegm out too. It's working. It's got a piece. And you know, these things come apart too. And I'm not going to go through the tutorial of cleaning up things, but you want to be able to clean these up and also realize that this one, you can make it low or high. I like the devices that you can connect and make it one device. Okay, so you see this one, I wasn't able to make this connect because what I'm thinking is you can save some time by combining the 2, right? So I want to show you that that's the only downside to this. Otherwise, I like this device. I wish it could fit with a nebulizer, and then we can make a nebulizer and a flutter valve together. And like I said, I don't sponsor any of these. I'm just reviewing them. So you are very welcome to try them yourself and find out which one really gets your phlegm out. You're going to write back to me and tell me which one you prefer. But for me, trying these out, I think all of them will work if you're not able to cough on your own. And some have an advantage and a disadvantage. And I'm going over this one. The disadvantage to this one and this one is that you can't hook them up to this device. And I'm actually going to give you a bonus one. Since you stayed this far, I'm going to review one more right over here. But that's going to be next, okay? So this one is easy. You blow in, you're blowing in. And you would do this until you feel the phlegm has cleared up right after your nebulizer, like I said. We still have that nebulizer, you would do that first. Because you cannot connect these, right? You can't connect these. You can't do it all together, but I'm going to show you at the end how one of them you could, okay? So this one is device number 2. You have to pick what works for you. But if you're lingering phlegm, I advise that you need to do something more. Obviously, if you haven't really been attentive about your inhalers, you need to review those and you need to go back to see your doctor. I'm not saying this is the primary treatment for you. Again, I'm here to just review the fact that part of your treatment plan should include cleaning it out, coughing it up, okay? And we can't keep it in there because it becomes a septic tank. We all know what's in a septic tank. It cannot be in your lungs. And we can't get you better if you personally can't get it out. So it's either you get it out or we get it out. Antibiotics do one part, which is cleaning out the lungs and trying to help them, get rid of the inflammation that caused that phlegm in the first place. And if you have an infection, we try to tackle it. You should look at the video where I'm saying get that phlegm sampled and sent to the lab. Right? Why? Because you may need to know exactly what bug it is rather than just guessing and giving you this antibiotic, that antibiotic, this antibiotics back and forth. You should tell the doctor, time out. What is it? Treat it, get it all collected, take it out. Yeah, you should be able to tell your doctor. Nicely, of course, not time out. Be nice. Talk to them, get an x-ray. Make sure it is truly bronchiectasis and nothing else is on your chest. Please get an x-ray if you need one. I actually recommend you do that. And I frequently check my patients for masses and other things that could be coughing and doing other things that are funny. And we do not want to treat you and assume it's always asthma or COPD. Of course, asthma, COPD all leads to bronchiectasis if you don't control it, and especially if you keep a lot of infection. So we're here because of that. Next is this one. This one is called a cappella. This one also has a mouthpiece that you can put right there. And it's got a way to make it tighter and make it lower, and we can make it higher depending on how you blow in it and how it helps you kind of cough up. Okay, can you cough it on your own? Yes, you can. But if you can't and it's lingering, everybody hears that wet cough, and I know everybody knows how it sounds. Okay, if it doesn't, maybe search it up. I'm sure somebody's posted how that sounds. And we don't want that, because that's also an invitation to more trouble. You're not helping yourself. You're not hiding. It's actually going to brew into something more serious later on. If it's not a pneumonia very soon, it's destruction, complete destruction, and the lungs will be completely kaput, like I said. See, you blow into that. I like to give my patients saline sometimes, or hypertonic saline, because it's salt and special salt, of course, sterile, because we don't want to infect our lungs. We don't want our lungs to be infected, right? We don't want to put something that's contaminated in our lungs. So these nebules that are saline also, they are prepared so that they're sterile, okay? But if you have albuterol in here, or budesonide in here, or Duoneb, whatever your doctor has prescribed, you want to put that into your regimen, and you want to do that first, obviously, right? First thing in the morning is perfect, but if you have 3 times a day, you know that you need to, do all that, right? I'm going to open up my nebulizer and put in my medication. Listen, you guys should look up the videos that I have that relate to cleaning these devices, because we definitely don't want to have infections in here that we keep breathing in. So after you're done, clean them up, or at least, every 3rd application, maybe. At least if you're realistic, you can wash them every day if you want. You can change them every day. But I'm talking about being realistic here. So this is on. I'm going to do a treatment. I'm not going to be with you the whole time, but I'm going to do a treatment, and then we can do our next part, which will be using those devices. Thank you so much for sticking around all this time. And this is called VibraPep. It also has, you can make it harder and easier. Twist, easy to hold. I'm going to talk about this one because it's so cute, right? Hold it like this. I'm sure you can hold it like this too, but yeah. It sounds like phlegm, but it's not phlegm. Okay, guys, I don't have phlegm, and I don't want to break my device, honestly. See here? This is what, it doesn't work here, but when you blow in here, I think it vibrates inside. And when you're fitting it in right there, you put it right there. You see that knob right there? This one? You put it right there, and then you twist it. You see? Yeah. You'll understand when you have it. This one is not on Amazon. I did not find this on Amazon. This piece here, make sure it's covering over here. I just took it apart for you, but like I said, this is how you'll take it apart when you're washing it. This is not the washout series. I'll do that another day, but you'll be using this device. Don't put that in there right now. Okay, now this here is a VibraPrep being used to help you cough up all that phlegm. Then maybe nebulize again and do a few sessions. How do you know you're done? All the phlegm is gone. If you keep pouring out, then I guess after 15 minutes you should stop, otherwise you'll pass out. But once you feel like you're coughing less and you're less productive, then you will do it. Don't be in such a hurry. When you wake up in the morning, you probably naturally have phlegm coming out, pouring out. Get rid of that first, then nebulize. Allow the lungs to get the medication, and then go back to sit down to do this again. I should have done it live. I don't know why I didn't think of that. Definitely on Amazon. We're going to discuss this as a bonus. I'm going to open this up, right? This part, take this mouthpiece up and just replace it with this mouthpiece. You see? It's only going to fit one side, okay? Now, I have done lots of videos of this. You can put this in. I don't find that it's useful to put the whole thing up. But let's say you turn this on, right? See? It's coming out, right? Okay? And you can take this out, but you can also connect it. And you're going to see it over here. You can see it. Little bit of it. You can... Look. And this one here. This one is set as hard. This one is set, easy. So you do that, and I would recommend maybe do like 2-3 minutes, and then connect it and start nebulizing and doing the flutter valve together. This is an a cappella. I keep saying flutter valve, but just in your mind, just say a cappella for this one. One is Eravistas, VibraPep, and the Oper Care. Oh my gosh, they are all tongue twisters. And this is a cappella. I like the a cappella because of the fact that you can connect, but then again, I have to tell you, price-wise, they vary. You need to look at what is your price range that's more compatible with your bank. And bronchiectasis is not compatible with anybody's bank because it is really very aggressive and very tormenting and horrible. It's almost like asthma coming back later to bite you. And I say that on my video on TikTok. So if you haven't watched that video, please go ahead and watch it. And I wish you all the best in this journey.